Hello. Thank you for participating in this RBT training. This training program is based on a registered behavior technician task list and is designed to meet the 40-hour training component for the RBT credential. The program is offered independent of the BACB. RBT Curriculum Section A, Measurement. This section deals with items related to data collection and how to measure behavior. A01, Prepare for data collection. This item is looking at, can the RBT prepare appropriately for data collection? Do you have data sheets needed when session starts? Are materials ready? Do you know what type of data collection you are doing? Will you be taking trial by trial data? Will you be taking frequency data? Basically, preparing for data collection is looking at, does the RBT understand what they are doing as far as data collection during that session? A02 is referring to implementing continuous measurement procedures. Does the RBT know what a continuous measurement procedure is, such as frequency, duration, latency, etc.? Remember, frequency is the number of times this behavior happens. Duration is how long it happens. Latency is the link between the instruction and the behavior actually occurring. And a continuous measurement procedure means that you are measuring continually each instance of the behavior. A03, implement discontinuous measurement procedures such as partial and whole interval or momentary time sampling. This area is addressing whether the RBT knows how to implement these discontinuous measurement procedures. Remember, discontinuous means that we're not going to be continually measuring. We're not going to be measuring each instance of the behavior. Remember, partial and whole interval, the interval sampling, refers to marking in an interval some sort of time frame whether a behavior occurred or not. In a partial interval recording procedure, you will record the behaviors occurring in each interval if there is at least one behavior or one target behavior within that interval. So, for partial interval, to mark the interval, only one behavior has had to occur within that interval. That is the only criteria, at least one behavior within that interval. Whole interval, on the other hand, you can only mark the interval as occurring if the behavior happened throughout the whole interval. Momentary time sampling, that's the one where we have the intervals, we have whatever the time of the interval is, say like 5 minutes, and you look up at the 5-minute mark, at the interval mark, and if the behavior is occurring, you mark it as occurring, you mark the interval, and if it doesn't, you don't. So momentary time sampling means you're just referring to the time you look, whenever the interval's up, you look to see if the behavior is occurring. That's the only time you look to see if the behavior is occurring, at the end of the interval. A04, implement permanent product recording procedures. Does the RBT know what a permanent product is? Does it know what a permanent product recording procedure would be? Remember, a permanent product means that the behavior left some sort of mark, some sort of change in the environment that you can observe to know that the behavior occurred. So if I'm keeping track, say, of how many times a person marks on a wall, and I leave and I come back and there's 5 marks on the wall, because it leaves a permanent product, a change in the environment, I can see that. That is a permanent product. And a recording procedure for a permanent product would just be to mark that it happened, depending on what the analyst wants you to do. A05, entering data and updating graphs. Does the RBT understand how to enter data or update graphs on the data sheets? Remember, data collection and graphing is very important. This allows us to see if what we're doing as an intervention is actually working. The RBT should know how to enter data on data sheets, should know how to read graphs, and how to update them if needed. Measurement is a very important tool within ABA. Measuring allows us to see whether the procedures that we are using are being effective for that individual learner. Remember, one of the 7 core components of ABA is effectiveness. By using measurement systems, we are making sure that what we're doing is working. Conversely, if we don't have some sort of measurement system, we're just eyeballing it. We don't know if what we're doing is actually being successful. So again, RBT Curriculum Section A has to deal with measurement. Each of these items deal with data collection or measurement in some way. You'll be doing more of this in your in-field training, but right now just be familiar with each of these task list items. Planning for program. It is your responsibility to plan ahead so the child can have a successful session and receive immediate reinforcement. Remember, if you're having to spend all the time organizing stuff and reaching for things, that's just more opportunity for the patient to engage in aberrant behavior. Stay organized. Have materials ready and tidy. Know when and where you're going to run those certain programs. And when running programs, have as few stimuli in the environment as possible. Have the work area prepared ahead of time. The more lessons you run, the better, as we're utilizing our time. Read the goals carefully. What exactly does this person need to do? What does a correct response look like? What about the incorrect response? What is the SD? The instruction. What prompts will you use if needed? Make sure the data sheet is ready and positioned to take immediate data. Give reinforcement. So you got to find that reinforcement and have it prepared and to be able to give it immediately. Before beginning any program, you should have reinforcement ready. And remember reinforcement sampling and preference assessments. Preference assessment being allowing the person a forced choice. Do you want this or this? And reinforcement sampling is when you let that person have a little bit of the reinforcer, see if they'll actually like it. So if, let's say you are using like M&Ms, you give them like 1 M&M for free. To say, hey look what I got. Or if you're using a favorite toy, let them play with the toy for a few seconds.